ഞാൻ ഓഡിബിൾ ആണോ നിങ്ങൾക്ക്?
Yes, ma'am.
ഞാൻ വിസിബിൾ ആണോ നിങ്ങൾക്ക്? ഹലോ,
സ്ക്രീനാണ് കിടക്കുന്നത്.
ഗുഡ് മോർണിംഗ് ഷീലാമ്മ മിസ്.
ഗുഡ് മോർണിംഗ്, വെരി ഗുഡ് മോർണിംഗ്. സുഖല്ലേ?
സുഖം സുഖം. ഭയങ്കര സന്തോഷമുണ്ട്, നമ്മുടെ യൂണിവേഴ്സിറ്റിക്ക് വേണ്ടി ചെയ്യുന്നുണ്ട്.
ഓക്കെ ഓക്കെ. എല്ലാരും തിരക്കിലാണ്, അതുകൊണ്ട് പല പരിപാടികൾ അറ്റൻഡ് ചെയ്യാനോ നമ്മുടെ അതിന്റെ ഭാഗമാകാനോ പറ്റുന്നില്ല. ഇനിയിപ്പം ക്യാപ്സിന്റെ പ്രോഗ്രാം നടക്കുകയാണല്ലോ.
അതെ അതെ.
ഇന്ന് ഫെലിസിറ്റേഷൻ അല്ല, ഇന്ന് അതിനകത്ത് ഒരു സെഷൻ മോഡറേറ്റ് ചെയ്യാനായിട്ട് സാർ ഇന്നലെ രാത്രിക്കാണ് ആവശ്യപ്പെട്ടത്. പക്ഷെ നമ്മുടെ പരിപാടി നടക്കുകയല്ലേ ഇപ്പൊ, അത് കാരണം പ്രോഗ്രാം നടക്കുന്ന കാരണം അത് ചെയ്യാൻ പറ്റില്ല എന്ന് പറയേണ്ടി വന്നു. ലക്ഷ്മി PhD കഴിഞ്ഞായിരുന്നോ?
ഇല്ല മിസ്സേ, ഞാനിപ്പം MPhil കഴിയാനായി, ഫെബ്രുവരിയിലാണ് എക്സാം.
രജിസ്റ്റർ ചെയ്താൽ ആ കൂടെ അങ്ങ് പൊക്കോളും, വർക്കിന്റെ കൂടെ അങ്ങ് പൊക്കോളും. നമ്മൾ പ്രൊഫഷൻ മാത്രം നോക്കിയിരുന്നാൽ ചിലപ്പോ അവിടെ MPhil PhD ഇല്ല അല്ലേ?
ഇല്ലില്ല.
PhD സെപ്പറേറ്റ് ചെയ്യേണ്ടി വരും.
PhD സെപ്പറേറ്റ് ചെയ്യണം. അതാ ക്ലിനിക്കൽ MPhil ചെയ്യണം എന്നുള്ള ഒരു ഇതുകൊണ്ട് ഞാൻ
അതാ നല്ലത്.
അപ്പൊ ഒരു ക്ലിനിക്കൽ എക്സ്പോഷറും കൂടെ കിട്ടൂലോ എന്ന് വിചാരിച്ചു ഈ 2 വർഷം.
തീർച്ചയായിട്ടും നമ്മളൊരു ഒരു ഏരിയയിലേക്ക് ഡെപ്തിൽ പോയി കഴിഞ്ഞാൽ നമുക്ക് പ്രൊഫഷണൽ ആയിട്ടും വളരെയേറെ മെച്ചമുണ്ട്. ഗൈഡിനൊക്കെ കണ്ടുപിടിക്കപ്പോഴേക്കും ടോപ്പിക്കൊക്കെ ഫൈനലൈസ് ചെയ്ത്
നോക്കണം. ഈ വർഷം തന്നെ കയറണമെന്ന് വിചാരിച്ചു, പക്ഷെ ഇതുപോലെ ഞാൻ എക്സ്റ്റെൻഡ് ചെയ്ത് പോകുമെന്ന് വിചാരിച്ചില്ല കോഴ്സ്.
പക്ഷെ ഇപ്പൊ ജസ്റ്റ് രജിസ്റ്റർ ചെയ്തിടാം.
ആണല്ലേ?
നമ്മൾ കോണ്ടാക്ട് ചെയ്ത് നമ്മള് അവൈലബിൾ ആയിട്ടുള്ള ഗൈഡിനെ നമുക്ക് ആവശ്യമുള്ള നമുക്ക് ഇഷ്ടപ്പെട്ട ഗൈഡിനെയൊക്കെ അന്വേഷിച്ച് കണ്ടുപിടിച്ച് ടോപ്പിക്കൊക്കെ ഫൈനലൈസ് ചെയ്യുമ്പോഴത്തേക്ക് ഏകദേശം സമയമാവും. അപ്പോഴത്തേക്ക് എംഫിലും കഴിയാറാവും. ജോയിൻ ചെയ്യാം. അപ്പൊ നമ്മുടെ ഇതിന് റെഡിക്ക് സാധനം ഉണ്ടായാൽ പെട്ടെന്ന് കയറിപ്പോകും. രജിസ്റ്റർ ചെയ്തിട്ട് പിന്നെ സമയം കുറച്ച് എടുത്താലും കുഴപ്പമില്ല. എന്തെങ്കിലും ഒരു ചൂട് വരുള്ളൂ.
താനൊന്നും പറയരുത്.
Yes, അതായി. കേറ്. ഞാൻ വാട്ട്സിൽ ലിങ്ക് ഇട്ട് തന്നിട്ടില്ല. അതുവഴി കയറാൻ പറ്റും നോക്കി.
Cake.
കൊച്ചാപ്പാനോട് അങ്ങനെ ചോദിക്കണ്ട മോനെ.
ഇതെന്താ കുറവ് നല്ലിരിക്കുന്ന മൂത്രമൊഴിച്ചാണോ?
ഹലോ, എല്ലാരും മൈക്കൊന്ന് മ്യൂട്ട് ചെയ്ത് സംസാരിക്കണേ.
ഒഴിച്ചാ അപ്പൊ നീ എന്നാ ചെയ്തേത്താനെ?
സുരേഷ് സാർ എത്തിയില്ലേ? സുരേഷ് സാർ, സമയം 11:15 നമുക്ക് സെഷൻ തുടങ്ങാമല്ലോ.
തുടങ്ങാം മിസ്, തുടങ്ങാം.
ഓക്കെ.
Good morning, distinguished guests, faculty members, students, and participants of this webinar. We, the Department of Social Work, Sri Shankaracharya University of Sanskrit, Turavu Regional Center, is hosting the second webinar of our webinar series, BODHI 2020, on the topic Suicide Prevention, a Public Health Approach. We would like to remind all participants to mute your mic and turn off your video during the session. To begin with, I would like to invite Ms. Ragendu ji for the official welcome.
Am I audible?
Yeah.
Good morning to all. Welcome to the second section of the BODHI webinar series organized by the Department of Social Work, Sri Shankaracharya University of Sanskrit, Regional Campus, Turavu. I am here to welcome all those who have to participate in the second section of the BODHI webinar series. First of all, I would like to welcome the campus director of the regional campus, Turavu, Dr. Bichu X. Malayar, and head of the social work department, Dr. Reshma Bharadwaj. Teacher in charge of Turavu regional campus, Dr. Sheelama Vasavan. Teacher in charge, Thiru regional campus, Dr. Justin PJ. Teacher in charge of regional campus, Payyanur, Dr. Anida A. and Dr. Josh Anthony Sir, Professor of Social Work Department, SSUS Kaladi, to the section. Next, I would like to welcome today's chief attraction, Ms. Lakshmi Sia, and I would like to welcome the moderator of the session, Ms. Sanu Balanke, Faculty of Social Work Department, Regional Campus, Thuravur. And next, I would like to introduce and welcome Ms. Lemia SR, Indian Sign Language Interpreter. She is the first year MSW student at SSUS Kaladi. Along with us, I am welcoming all the faculties of the Social Work Department of other regional campuses. I also welcome the faculty coordinator, Mr. Suresh Siyar, and other faculties of Thuravur Regional Campus, Ms. Daya Vijayan, Ms. Ajimol Enne, and Mr. Krishnanuni. Last but not the least, I would like to welcome all the teachers, students, and other participants from Thuravur campus and also from other colleges who are present here. Once again, on behalf of the Social Work Department of SSUS Regional Campus Thuravur, I welcome you all to the second session of the BODHI webinar section. Thank you.
Hello.
Yes, Miss Audible, Anna.
Audible, Anna. Okay. So we'll start our second session of BODHI 2020. So today I would like respected Shilama teacher, our teacher in charge, other teachers, colleagues, my students and other participants. Today our topic is suicide prevention, a public health approach. So I would like to start with suicide, right? See, when you start your reading your newspaper or scrolling down your Facebook, you ending up reading a news about suicide, right? So actually the National Crime Record Bureau also reports that even 381, an average of 381 persons commit suicide in India daily. And there is a hike of suicide rate after the pandemic COVID-19 pandemic also. So I would like to talk about the perceptions of people when they talk about what suicide. See, when a person, a common layman, when he hears about that someone has committed suicide, the most probable reaction of him would be like, how coward this person is to commit suicide. We never think about, what the a person actually has gone through, or how he could have prevented that suicide, how he had ended up running out of his coping mechanisms and all. We never think about that. We just label him as a coward person, right? So even the judicial system of India actually used to perceive suicide as a criminal offense prior to 2017, right? So before 2017, if a person tried to commit suicide, then he will be punishable, right? Then now after 2017, this offense is being decriminalized. So I would like to tell that this might be the first step that the suicide is being understood as a health problem rather than a criminal offense. The person who tried to commit suicide or attempt to commit suicide would be given some treatment or intervention rather than punishing him. Okay, so I would like we have got an eminent person to talk about this topic today, Miss Lakshmi C.R. I'm really proud to introduce her because she is the alumni of Sri Shankaracharya University of Sanskrit Kaladi. So she has done her MSW from Sri Shankaracharya University of Kaladi, and she has a work experience with a Thrissur-based NGO called Augustine Oaken Revitalizing Agency. And currently, she is the MPhil research scholar in the Institute of Mental Health and Neurosciences, Calicut. She also have hands-on experience in conducting suicide prevention workshop, which is standardized in National Institute of Mental Health of Neurosciences and Neurosciences for the last 2 years under the guidance of Institute of Mental Health and Neurosciences, Calicut. So, Lakshmi, the platform is yours, and we would like to hear your talk regarding suicide prevention and public health approach. The platform is all yours. Okay.
Thank you, ma'am.
Okay.
So, let's move on to my topic, suicide prevention, a public health approach. We all know that suicide is a major public health issue, which is highly complex and multifaceted. Suicide is always a contagion, that means a disease spread by close contact, that we will discuss in later. And many statistics has shown that approximately 8 lakh people commit suicide every year. And so, while discussing about suicide, there is always a question that is suicide prevention possible? There may be different opinion among you people, but in reality, suicide prevention is always possible. And we always call a person who believe that the suicide can be prevented as a gatekeeper. He's the one who can prevent suicide, and a person who want to prevent suicide should have the willingness to give time and energy to prevent suicide. A professional, he can be a teacher or a doctor or a nurse or a social worker or a psychologist or a community leader, or anyone can be a gatekeeper. That means a person who can prevent suicide. Only thing is, they should identify the person at risk for suicide, and they should be able to assess suicidal risk, and they should be able to provide immediate intervention and referral as well. While discussing about suicide, we should know what is the difference between suicide and self-harm. So first I'll say, what is suicide? We know that suicide is always an act of ending one's life. That is the main thing. In suicide, there will be an act of ending one's life, and there will be sense of hopelessness and helplessness will be there. And it can be planned and impulsive. Or if we take any suicide cases, it can be either be planned or impulsive. And while coming to self-harm is always a self-inflicted injury, and it can be a way of expressing distress. There is no intention, there will be no intention that the person want to die. It's actually self-harm is always a coping mechanism to overcome the current distress of the current situation in one's life. As I told earlier, it's more about staying alive than taking one's life. Still, the death risk of for death cannot be ignored. We cannot ignore the risk for death. As I told earlier, it's a self-inflicted injury. So, can you please mute yourself? Okay. So the risk for death cannot be ignored. Even the because the injury can go so deep that the person may end up in ending one's life. While discussing about suicide prevention, we should identify, we should understand there are the warning signs that depicted by the patient, the index patient. during another webinar 2-3 months back, especially for suicide prevention among children, uh, uh, two or three person had told me that after the webinar, they told me actually these warning signs were depicted by most of the like in all these suicide cases that we have observed. But the thing is that no one had identified this warning sign. So warning sign is that important that everyone should be able to identify it. So let's check what are the warning signs. A person with high suicidal ideation may talk about that they are wanting to die, or they may look different ways to kill themselves. Or they may be talking about feeling of hopelessness or having no reason to live. Sometimes when a person talk like this, we make it like we may mock them. Hey, what like you don't have any such issues. The other people have more issues. Even I have more issues than them. So please don't ignore these warning signs. And another is that talking about any trap in their life or any unbearable pain, or talking about being a burden to others. Increasing use of alcohol or drugs, or being more anxious and agitated. A person with high suicidal ideation will have sleep disturbances. He may be sleeping very little, or he may be sleeping too much. So sleep disturbances may be there, a withdrawing from the society, or always sitting isolated. You can see some people always withdraw, and like in earlier times, he may be an active person, or a very active person, and he may withdraw from the society, and he always spend time in solitude. So it's also a major warning signs. Or talking about revenge or seeking revenge, that can be also a warning sign for suicide. Or displaying an extreme mood swings. These all these warning signs are very serious, that we should not ignore any of these warning signs. And it is very necessary to identify these warning signs to prevent suicide. So if we want to prevent suicide, we should identify two things, that is the risk factors and the protective factors. It is important to identify these risk factors as well as the protective factors. So first I'll move on to the risk factors. The major risk factors that you should take into consideration are previous suicidal attempts or any underlying mental disorders. It's not necessary that only depression can cause suicide. It can be psychosis or any other mental health disorders, or any co-occurring mental and substance abuse disorders can also be a major reason. And family history of suicide. We always, in our clinics, we always consider a person with a strong family history of suicide as a high risk category. And impulsive or aggressive tendencies. Some person may be very impulsive. So that individuals are also should be considered as under high risk categories. And barriers to accessing mental health treatments. That can be an unwillingness to seek help because of stigma. Especially if we take the case of Kerala or India, stigma is a major risk factor. Many people are unwilling to seek help because in fear of stigma. And other risk factors are relational or social or work or financial losses. All these can also lead to suicide. And any chronic physical illness, especially any kind of terminal illness, can also lead to suicide. And easy access to lethal methods is also a major risk factors. Cultural and religious beliefs. In some traditions, suicide is not at all considered as a sin. This can also be a strong risk factors. Then influence of significant people, family members, celebrities, peers who have died by suicide through direct personal contact or inappropriate social media representation. As Ms. Sunum told us earlier in the beginning that about the media represent, when we read a newspaper, we always end up seeing one or two suicide cases. And if we read that newspaper reporting regarding the suicide, it will be like a detailed description of suicide, how the person committed suicide, what were the problems in his life. All this will be in very detail. And that can, many studies have proven that that can lead to suicide. For example, I got after the death of Sushant Singh Rajput, the renowned actor Sushant Singh Rajput, I got many calls that I am facing similar issues like him, and I don't know, that I am really afraid that whether I will die. Like that, I got many calls. So inappropriate media representation is one of the major issue that we face today. If we, in some other countries, not considering to India, in some other countries, if we check the media reportings regarding the regarding suicide, we'll only see that a person died. Like only a brief description will be there, not such a detailed description won't be there. And while assessing suicide, there is a acronym by American Association of Suicidology. You can, whenever you want to assess a suicide, we can use this acronym, or you can just remember this acronym. That is EASE Path 1. That means I for ideation. Ideation means suicidal ideation. S for substance abuse. A person with substance abuse is at suicidal risk. And a person with purposelessness. P for purposelessness. A for anxiety. T for trapped. A person may say that I'm trapped in such a situation that I cannot overcome. That can be a reason. Or a hopelessness. I don't see any hope. A person may say to you that I don't see any hope in my life. I want to end my life. So hopelessness can be a reason. Withdrawal from the society can be a reason. W for withdrawal, A for anger, R for recklessness, and M for mood change. So EASE Path 1 is very important in assessing suicide risk. This can be used by any one of you for assessing the risk. Always, it's a doubtful fact for many of the people that asking suicide is if we ask about suicide, does it increase the risk of suicide? This is a major question raised by many of the people during while discussing about suicide prevention. Actually, there is no such proven evidence that asking about suicide increases the risk of suicide, and only if the question is asked properly. So it's a big no that asking of suicide does not increase the chance for suicide. So we always we do not promote asking. Please don't ask indirect questions and direct questions. Rather use normalizing questions. Okay. it will be very awkward that if you go to a person and who is very depressed and ask them, are you suicidal or have you been thinking of killing yourself? Like, don't ask such direct questions, rather ask normalizing questions. Like, you can, for example, you can ask, sometimes when people are feeling disturbed, they think of suicide. Is this something you're thinking? Like, such normalizing question can be framed and you can ask such normalizing question. If you're not that confident to ask such normalizing question, or you're not comfortable in asking questions, just find someone that who is able to ask such question. That will be much better, and don't end up in trouble with overconfidence. So and so one more thing is that that I forgot to tell you about protective factors. Okay, protective factors is also very important, uh, like risk factors, like assessment of protective factors. I'll give you a very small example of protective factors. Protective factors, so that you can easily identify protective factor. A person with a high occupational stress and with a suicidal ideation, but having elder parents, like who doesn't have any siblings and the parents are dependent to him, and having a supportive life partner as well. So here the protective factors is his parents and the life partner. So this can be a protective factor. In every individual, there may be a protective factor and as well as a risk factor. So it is important to identify the protective factors and risk factors while assessing suicidal risk. So usually, while after assessing suicidal risk, we classify suicidal risk into 3 levels. That is high, moderate, and low. So in every person with a suicidal, like a strong suicidal ideation, it is said that there will be a detailed plan that when, where, how, and what method that they are planning to use. A clear-cut suicidal plan will be there. It can be like if we get a person with a, if we come across a person with high suicidal risk, we can assess all this presence of all those factors. So is there any plan, like when he is going to planning to die, and where which place is going to opt, and how which method is he going to use, and we can assess this plan. And moving on to the level of suicide risk. A person with a depression or any kind of psychiatric illness or any other triggering events that in his life, and absence of protective factors, and who has made any lethal attempts or any recent suicidal attempt, or having recurrent thoughts of suicide, are considered to be at high risk for suicide. They always require admission to a psychiatric setup and removal from all lethal methods, access to all lethal methods, and a vigilant supervision by the individuals is very necessary in high risk situations. And while considering to moderate risk, there may be multiple risk factors may be there, and the protective factors will be comparatively low. In high risk, there will be completely absence of protective factors, and in moderate level of risk, there may be few protective factors. And ideation with a plan will also be present with moderate risk individuals. For okay. And in such cases, admission it may be necessary. It depends upon the with the clinician who is assessing the individual, and a crisis plan is necessary. Developing a crisis plan is very important in such cases, and frequent observation by a fellow mate is also very necessary in individuals with a moderate risk. And moving on to the low risk category, there may be only a few risk factors compared to others, and there will be very strong protective factors will be there. And the thought of death may will be there. There may not be any plan or intent or behavior, but like sometimes at some point of time, a thought of death will be there. So in such cases, it would be better that you refer the individual to a counselor or a mental health professional for an outpatient service. It will do for the low assessment people. And so after assessing the risk and all those things, we may wonder what we can do, like what immediate intervention can do to prevent suicide. It is also a major question. It will be also a major question for you all. So most important thing to do is, if you come across a person with suicidal risk, is be a good listener and pay full attention to him. The person may full of like different thoughts and like pain and sufferings and all that. So if we are a good listener and if we pay full attention to him, a proper ventilation can even distract his thought. So always when we come across a person with high suicidal risk, just be a good listener and pay a full attention to him, and just offer him like whether offer him help and ask him whether you can help or not. And please stop being judgmental. Many people that come across, even professional, there is highest chance of being judgmental. So always be non-judgmental. And that is very important in suicide prevention. And one of the major thing in suicide prevention is please be more supportive to them and instill hope in them. It is very much important. Like they may be feeling, they may be having complete hopelessness and worthlessness in them. So instill hope. That is a major thing that you have to do, and be a support to them so that they can distract themselves. And building a suicide contract is also important in suicide prevention. It may sounds funny, but you should build a contract with the person with the suicidal ideation. Even in clinics, in our clinics, we come across a patient with suicidal ideation. We used to build up a no suicidal contract with them. That means we will ask them to promise us not to kill themselves until we find a help for you. In many of the situations, it prevents the individual from, to some extent, from killing themselves. So and ask them to call you at any time. Be always vigilant. So ask them to call anytime while they get the suicidal thought. As a part of this contract, we should also provide a detailed crisis plan and which act as a safety net for them. It can be a group of people. Okay, and so in crisis plan we can ask them like whenever just ask them whenever you get a strong suicidal thought, just try to distract yourself by uh, doing like any kind of leisure activities that you personally like. Don't force them to do such and such things that may be very awkward for them, and it will be more painful than suicide. So please don't force them to do such thing like any particular thing. Rather let them choose what they like to distract the activity, like their thought, the suicidal thoughts. It can be watching television, or it can be painting, or drawing, or shopping, or cooking, or talking to friends, or any such activities that can distract the individual from their suicidal thoughts. And ask them to involve in physical activities also, like walking, exercising. Also this can help in distracting their thoughts. Or just ask them to write down their thoughts in a diary. It can be also helpful. If and one more thing, if a person don't wish to write all those thoughts in a diary, don't force them to sit. You at this moment you have strong suicidal ideation, so you sit and write 3 pages about your thoughts. Don't do that. Ask them if they are having high suicidal thought. If you wish, you can write down your thoughts in a diary, and you can provide all the solutions, all this different solution to them. Put forward all this different solution to them, so that they can choose whichever solution they want. Or and ask them to remember that you about the promise or the no suicide contract that you have made. And always make a circle, like a safety net, as I told earlier. It may be friends or counselors, or any mental health professional. So make a group or safety net for him or her, for preventing him from this suicidal thought. Or you can ask them, whenever you get a suicidal thought, you can ask them to talk to a friend, or to find a probable solution or distract his suicidal thought, like whom you can open up with. Or you can call and talk to your personal therapist as well, or your doctor, or anyone you can talk to distract your suicidal thought. It may not be necessary that all these people are available at the time when you get a suicidal thought. It can also be happen. So just ask them. If we Google just suicide helpline, or uh, just suicide itself, we will get many suicide helpline free helpline numbers we will get. Or just provide some suicide helpline numbers to them. All this crisis plan can also help them to prevent suicide. And uh, if when we consider the case of children, we know that in lockdown period, many students, many children had committed suicide in the lockdown period. So if we consider in the case of children, we use another acronym for assessing the suicidal risk, like identifying the person at suicide. That is NET. We'll call it as NET. That means notice, engage, and talk. First, you have to notice whether the child is having any such symptoms, as I mentioned earlier in the risk factors, any such symptoms. And you just engage with them. Like, it's not children are really different, and children only open up if they like if we have a close connection with them. So try to engage with them, and then talk about all these things. So assessment and intervention, all these things are similar in case of children as well as in adults, but only the difference is this. In children, we use first we notice and we engage with them, then talk with them. Okay, and I hope you all got a brief description about suicide and suicide prevention. So thank you. Any more questions?
If anybody would like to ask questions, you can ask questions. Students?
So
Somebody asked about, can you say about the symptoms
suicide
again?
prevention. Okay. As I told earlier, suicide prevention, suicide will a person with strong suicidal ideation will always have any kind of underlying psychiatric illness. It means there can be any underlying psychiatric illness can be there. A sense of purposelessness, hopelessness can be there. A strong history of substance abuse can be there, or anxiety can be can be a reason, or any trap in their life, or talking about such situations can can also be a reason. It can be anger or withdrawal. Withdrawal from the society is also a symptom. Showing extreme or expressing extreme mood swings without any reason can also be a symptom. All these are major suicidal symptoms. And it is not necessary that every individual depict all this symptom altogether. It depends on the individual.
If there is any other questions, participants, please ask questions. Lakshmi, shall I ask you something?
Yeah.
See, when we talk about suicide prevention, even the mental health professional who is having a depressed state or something like that, they do have a difficulty in getting help actually, right? There are people who have difficulty in getting help when they have a problem like suicidal tendency or depression, something like that. So the common layman also, they don't know whether they have to go for a help, seek help or not. So what is your view on sensitizing community about the suicide and all? What is your view?
Okay. Actually, it's a fun fact that professionals who are having any kind of problem or any kind of mental health issues won't be ready by themselves to go for a help. Okay. There may be many different reasons for them, and this may be because of the stigma created by the individuals by themselves, or it can be due to the like a stigma created by the media. When a typical example is that if we go for a if we hear about mental health, the first thing that come into our mind may be a typical case of a schizophrenic patient or something like that. All this can be the reason, like proper like complete stigma can be the reason for this reluctance to treatment.
Okay, Lakshmi, thank you. There is a question from Arya R. Kumar. The question is, if that person is showing not interest to involve those kinds of extra activities, what we can do? Can we force them to do, and how could we deal with that?
Arya, it will be very like awkward thing that we force things to do. So please don't force them. Just find their interest in which area that he or she is interested in, and just ask them to do that while distracting that thought. Like I had told all these examples, it's just mere examples. The in preference of the individual may different from person to person. So according to their interest, just assign activities to distract themselves. That may be much better. Or just ask them to talk with you, or like while with us when he is getting such thoughts. The suicide prevention is actually not a small topic, it's a very huge topic. And if we keep on discussing, it may be like very much time consuming. Actually, it's only a capsule of suicide prevention. I hope this can help every individual to understand how to prevent suicide, or take initial step in preventing suicide.
Lakshmi, there is another question, okay? Question from Bivin JB. So the question is, do we have any quick assessment or screening schedule for assessing risk of suicide in Indian settings?
Usually in our clinics also we use this, we check for the suicidal risk assessment like east path one we will use. Other than that, if we get a case with a suicidal risk, we will assess for depression as well as anxiety using BDI, then Hamilton Anxiety Scale. Such in the like assessments will be done, and to assess the level of risk, we don't use any such scales in clinics. I'm not sure about the Indian adaptation scales. Maybe I can share later on.
Thank you, Lakshmi. There is one more question from Jyoti Mall. So she has the question like, what if some person has become suicidal on social media? So there are many people who shows their suicidal ideas on social media and they commit suicide while online. So what can we do at that time? That is her question, I guess.
Yeah, see, social media is like social, such kind of suicide are increasing day by day. And one thing to all of you is don't promote or such type of like information to others, or please don't forward such information to others. It can also attract other people who are at high suicidal risk. If we know them in person, we can, of course, we can do some kind of interventions. And if the person is unknown to us, it's that way we cannot do anything because they are on social media.
Thank you, Lakshmi. There is another question on YouTube. How can we assess the family history of suicidal tendency or suicide?
Okay. Family history in suicide means we usually check in three generations. Is there any risk, like any person who had committed suicide in the family? That's what we check. And if there is any such individual in the family that who had committed suicide, what was their plan? And in some cases, with high risk, suicidal cases, there may be any family history of suicide will be there. It may be their parents or grandparents, or it can be their siblings as well.
Thank you, Lakshmi. There is another question. Can the risk for suicide be socially inherited? Parvati has asked the question. Can the risk of suicide be socially inherited?
Yeah, Parvati. So, like, suicidal risk is always socially inherited. That's why I told you initially that suicidal risk is a contagion. It's a disease spread by close contact. It can be inherited. We know the case of Ramsey, the suicide that happened recently. It was celebrated by all the medias for the past few months, and there were similar cases. If you check the newspapers, there were similar cases later on. So all this are suicide shows that suicide is always socially inherited. Suicide can be socially inherited.
Okay. Thank you, Lakshmi. There is a question from YouTube. How to keep suicidal people out of it? That is it.
That's what I told you.
Okay. See, there is another question from Sri Lakshmi S. Pillai. So, in what extent social media influence the suicide tendency during this pandemic situation? And what extent social media influence the suicide tendency during this pandemic situation?
I think that we should conduct a research on this topic, social influence of social media influence of social media during the pandemic situation and suicide. It's a good research topic, Sri Lakshmi. You can do it. It's a good research. And in my point of view, social media always has strong influence on suicide, and it's actually this inappropriate representations, this high threat of and for increasing the rate of suicide in India. There are many studies as well.
Thank you, Lakshmi. There is another question. Do people, from Sri Kumar ji, do people attempt suicide to prove something or to get sympathy?
I don't know whether you have listened to it properly, to the presentation properly, because initially I told that there is difference. There is different suicide and self-harm. Okay, in self-harm cases, people do like enact suicidal attempts. It's there won't be any strong intention to die, but they enact suicide just to get sympathy, or just to like overcome the current situation or the distress or the problem that they are facing. There won't be any intention to die, but they want to overcome the situation, or they want to overcome this distress. There may be different such cases, and we can easily identify how, like by asking them like how they did. For example, I had a case 1 year before, and she called her friends and told them that I am committing suicide, and she kept her door open and just hanged herself when her friends when she heard the calling bell, because she don't want to die. Only thing is that she just want to overcome this situation. Similar cases will be there. A lot of cases will be there.
Okay. Thank you, Lakshmi. Lakshmi, there is another question from Sridilam Shashidharan. He asked how to deal with or what type of intervention should be done to people who came out of suicide attempts.
If a person came out of a suicide attempts, we should ask them, advise them to go on a like long-term psychotherapy, or visit a mental health professional. If a person after a suicide attempt is admitted to hospital, he will be directly referred to a mental health professional, either a psychiatric social worker or a clinical psychologist.
Thank you, Lakshmi. There is another question. Is it possible to predict suicide?
If you know the warning signs, you can predict the chance for suicide.
Okay. Thank you. There is another question from Anjali M. Maji. When someone you are close to says, if you leave them, she or he will kill themselves, how can we solve that? If somebody comes and tells you that if you leave me,
Yeah,
I'll kill myself, how can we solve that?
just call them passionately and take to a mental health professional. That's the best way. And maybe after the assessment, she may need admission. If admission is necessary, just please admit her. They will cure them. That's the best option.
Thank you, Lakshmi. There is another question from Prithvi KU. From each day, the number of suicide cases increases. So, how can we help them in building their hope as a social worker? The number of suicidal cases are increasing. So, how can we build hope in people as a social worker? That is what his question is.
Okay. To prevent, as a social worker, to prevent suicide or to decrease the number of cases of suicide, the only thing that, like, the initial thing that you want to do is that to create to give proper psychoeducation to the individual. You can use community psychoeducation so that many people get empowered and know what to do when they are having such thoughts. That is the one thing, like initial thing that you can do.
Okay.
I hope it's clear, Prithvi.
Thank you, Lakshmi. There is another question. Can the risk of suicide be inherited? Lakshmi, the
Please
question.
explain.
I think
Like
he or she asked about the genetic inheritance. That is what I understood.
That's the same thing I mentioned earlier, that if a person have a strong family history of suicide, he should be considered in the high risk category. There is a chance.
Okay. Thank you, Lakshmi. There is
And
another
it's not,
question.
not
Okay.
necessary that a person having high suicidal. Okay, you can continue. It's okay.
Sorry. There is another question from Jane Prince. What biological factors increase the risk for suicide?
Biological factors in suicide. I hope it's better that a doctor should speak about the biological aspects of suicide. From a psychiatric social worker's point of view, like as I discussed earlier, underlying psychiatric illness can be a reason, or a family history, that genetic factors can also be a reason for suicide.
Thank you, Lakshmi. There is one more question. Okay. What is the psychology behind group suicide? For example, the whole family members commit suicide. So what is the psychology?
See, group suicide has been practiced, or was being practicing from the ancient time itself. If we check the history, there will be many such things. And in such cases, all the individuals may not be, when we cannot say that all the individuals where we have a strong intention to die, if we take a case of family itself. And another thing is that these group suicides can, media representation of this group suicides can also promote another group suicides. That is a major thing. That if sometimes if we see a group of three peoples, three close friends, like we will say that they all three committed suicide. It's because that if they have some problem in them, there may be any problem in them, and they may not be able to share all this things to others. And this will be celebrated by the media, and some other person or friends reading this thing can easily get influenced by all these things. See, this can also be a factor.
Okay, thank you, Lakshmi. There is another question from YouTube. Is tendency of doing suicide a mental disorder? If so, why? Its symptoms and cause can't be identified and treated earlier.
Can you please repeat the question?
Is tendency of doing suicide a mental disorder? If so, why its symptoms and cause can't be identified and treated earlier?
It's not necessary that every individual know this symptoms and causes of suicide, or the person who had committed the suicide, his close contacts must know, may not be in touch with him, or couldn't identify these symptoms. That can be the reason. Like if we want to prevent that, we want to educate, do massive psychoeducation. That's a one thing. That's it.
Okay. Thank you, Lakshmi. Lakshmi, there is one more question from Vishnu Bharadwaj. How physical weakness of a person and suicide be related? Physical weakness of a person and suicide be related. How can we relate physical weakness and suicide?
There are certain studies proven that a person with any physical illness, like chronic terminal illness, can end with suicide. It's because that in many cases they know they will die. Okay, they know they will die, so they don't want to and struggle their life all day, with all these pains and medicines and all, or they want to become a burden to others. All these factors are there, and all these factors can lead to suicide. And a person with a suicidal ideation may also depict poor appetite as well. There is chance of showing poor appetite, poor sleep pattern. All this can be a factor, and all this can affect the individual's health as well.
Thank you, Lakshmi. Thank you. I think all the questions have been answered. Is there any other question?
Lakshmi, I have one question. Let's say you have mentioned and discussed almost all aspects of suicide and suicide prevention. And as it is a very sensitive issue and a personal matter regarding the self-harm or the risk factors related to suicide, then what are the factors to be considered? One question. Second question is how we can handle the ethical and legal issues when handling the suicide.
Initially, suicide was considered as a crime, but recently it is being considered as a mental health issue. So so there is no such no much legal issues as of now. And if we identify a person or with a suicidal ideation, or a person, if we come across a person who had attempted suicide, for what we the patient will be directly referred to the psychologist or the social worker. That's a pattern goes. And ma'am, what was your first question?
Yes, yes. You are asking my first question?
Yeah.
Okay, okay. I'm asking you that is what are the factors to be considered when we are dealing with the suicide case?
That's what I told you, ma'am. Like what I discussed in this warning signs, we have to consider the warning signs. If he or she had depicted any of these warning signs, is any risk factors was there that I had discussed earlier, and the presence of protective factors. Like assessing the protective factor helps in not only assessing the risk and reducing the chance of suicide as well, and also helps in developing a proper crisis intervention plan for preventing the individual from further suicide attempts.
Okay.
So I think the questions, we have answered all the questions they have asked. So we can wind up the session. 1 minute, 1 minute, one more question. There is another question, Meenu Muralidharan. Does alcohol and other drug abuse increase the risk for suicide?
Of course, that's what I told you in assessing the suicide. Substance abuse and alcohol abuse is one of the major concern.
Okay. Thank you, Lakshmi. I think we can wind up the session, as we have already answered all the questions that have come up in the Zoom chat room and YouTube. Okay.
Thank you everyone for your patient listening.
Good afternoon, everyone. BODHI 2020, organized by the Sri Shankaracharya University of Sanskrit, Turavur Regional Center, had thus successfully completed their second webinar in the webinar series on the topic Suicide Prevention, a Public Health Approach. In this present scenario, this topic is much relevant for each of us. And our speaker, Lakshmi ma'am, will explain the need for the prevention of suicide. The way in which she explained this subject was very informative. I would like to thank Ms. Lakshmi C.R., MPhil scholar at the Department of Psychiatric Social Work, IMHANS Kolkot, for sharing your valuable words with us. Thank you, ma'am.
Thank you.
I would like to thank Ms. Lemia S.R., Indian Sign Language interpreter, who had been helping us with the sign language throughout this session. And she'll also be joining us for our next webinars too. Thank you, Ms. Lemia. Also, I would like to thank Mrs. Sanu Balan K., the faculty, Department of Social Work, SSUS Turavur Center, for being our moderator for this session. Thank you, ma'am. And I also would like to thank all our teachers of Turavur Center and our teacher in charge, Sheelama ma'am, for being a constant support and a lot of encouragement given to us. I also thank Vichu ma'am, Director, Turavur Regional Campus, Reshma ma'am, the HOD of Social Work Department, Kalidi, Justin sir, Teacher in charge of Tiru Regional Campus, Anita ma'am, Teacher in charge of Social Work Department of Payyanur Campus. Thank you, teachers, for all your valuable presence. I also thank all the faculties of our campuses who were present for this session and our faculty coordinator, Suresh sir, and all the participants for today's webinar who helped us to make this event a grand successful. I would also like to specially mention Prajahida Foundation Coricode, a non-governmental organization which aspires to create a society of enlightening and compassionate citizens. For today's webinar, Team Prajahida had helped us with a Zoom platform. So thank you so much for providing us this platform to conduct our event. Thank you, Prajahida Foundation. I must not forget to thank all the student coordinators and all the student teams who contributed in organizing our webinar, HODI. Once again, I thank each and everyone who participated in this webinar to make our event a grand successful. Thank you, everyone.
Thank you, everyone. The session is over.